Welcome everyone, this is Dr. Mercola, and today I am joined by Dr. Amen, who is a physician and board-certified child and adult psychiatrist, and he is a 5-time New York Times best-selling author, which is quite an accomplishment. He's also the medical director of the Amen Clinics in Newport Beach in San Francisco, California, Bellevue, Washington, Reston, Virginia, Atlanta, Georgia, and New York City. And he's also one of the foremost experts on brain imaging science, which is what we're going to talk about for the most part today. So welcome and thank you for joining us today, Dr. Amen.
Thank you. It's my honor.
Appreciate the opportunity. And we're going to talk about one of your specialties with this, which is SPECT scanning, in a minute. But one of my recent interest has been on brain plasticity. And I'm wondering if you could comment on that before, and if that it plays a part in your work. And by brain plasticity, of course, I mean the ability of the brain to recover and repair and actually assume new or older functionality, which it had previously been lost. And this seems to be in direct conflict with what is typically thought of the brain function, which is, once you lose it, it's lost permanently and you can't recover that. So I'm wondering if this is a part of your work and how your work enters into that.
Well, it's been a huge part of my work. About 10 years ago, I wrote a book called Change Your Brain, Change Your Life. Mm-hmm. And it's based on the imaging work that we've done. We can actually see the damage in your brain done by a wide variety of things. But on what I call a brain smart program, you can literally improve the function of your brain, which is happening through neuroplasticity. And your brain can actually look and feel younger, or look and feel more repaired. And very few people know that. We were actually able to prove it in a very large NFL study we did on 120 active and retired NFL players. And when they came to us, their brain was very damaged. I mean, not a little bit damaged, but these are people that had been hit in the head, sometimes 10 to 20 or 30,000 times in their lifetime. And on this program, what we'll talk about, 80% of them showed significant improvement, including boosting function and blood flow to the prefrontal cortex. So, we've had this rash of NFL suicides, which just breaks my heart, because what they don't know is that there is help available to them, and that's just very exciting. So about 21 years ago, I went to a lecture on brain SPECT imaging. And SPECT looks at blood flow and activity. It looks at how your brain works. So it's different than a CAT scan or an MRI. Those are anatomy studies that show what the brain actually physically looks like. Mm-hmm. They tend not to be very helpful for my business in psychiatry. At the Amen Clinics, we've done now 74,000 scans on people from 90 different countries. We have more experience with this technology than anyone, I think, in the history of the world. I was taught to use psychotherapy and medications, and that's pretty much it. And some of the medications I was taught to use, like Xanax or Ativan, Valium, for anxiety disorders, when I first started ordering SPECT scans, I saw that they made the brain look like alcohol. That they were really toxic to brain function. And that horrified me. And that is what actually led me. It was the imaging work that we do that led me to look for, okay, what are natural ways to decrease anxiety? And it has been very exciting because not only do we use this very cool high technology tool, but to get you well, we want to really work on your diet and exercise, correct the negative thought patterns you have, and look at, well, what are the natural supplements I can use to optimize brain function? When I see a toxic pattern, it's like, okay, I have to go find out what it is. I had another patient recently who was diagnosed with ADD. And, I saw the best ADD doctor in the country, but, he made the diagnosis, and it basically after 10 minutes of listening to his story, when we scanned him, he had a totally toxic looking brain. Of course, you have ADD symptoms if, there's damage to the front part of your brain. It turned out he had arsenic poisoning. And, you know, he needed a detoxification program, not more Adderall. And then what you realize is depression, anxiety, they're totally symptoms of underlying brain dysfunction. And you can have depression if your frontal lobes work too low, so they can't inhibit the negative feelings you have. You can have depression if your frontal lobes work too high and you can't stop thinking the bad thoughts in your head. You can have depression from a traumatic brain injury, very common, or you can have depression from some sort of toxic exposure or some really bad lifestyle choices, which you and I both know are rampant in our society. In my work, I've described 7 types of anxiety and depression, 6 types of ADD, 5 types of overeaters, and 6 types of addicts. And what the scans do is they really show you the individual areas of the brain, and they show you, are they working too hard or not hard enough? And so some common types, you know, if I just talked about my types of overeaters, we have compulsive overeaters, people who just can't stop thinking about food and the bad foods that are not good for them. And the front part of their brain works too hard. And that usually happens from a deficit in the neurotransmitter serotonin. So when serotonin levels go low, serotonin is in large part inhibitory to the brain starts to overfire. We see that in certain types of depression. We see that in OCD, and we see it in our compulsive people, whether it's a compulsive addict or a compulsive overeater. So that would lead us to target treatment with an intervention that boosts serotonin. So you can do it with one of the SSRIs, Prozac, Paxil, Zoloft, Lexapro, Celexa. But, you know, I've been a psychiatrist 30 years. I get weary of making people sick with medicine. So let me try the natural ways to boost serotonin. And you can do it with 5-HTP or L-tryptophan or St. John's wort or saffron. You know, there are 8 studies now with saffron showing it has equal efficacy to antidepressants, and there are virtually no side effects to taking higher doses of saffron. So a compulsive person leads us to a serotonin intervention, which, oh, by the way, exercise is a serotonin intervention. It boosts serotonin in the brain. Head-to-head, compare exercise to Zoloft. They're equally effective at 12 weeks. But at 10 months, exercise just beats the socks off Zoloft. So it targets what intervention. Say, for example, we have an impulsive overeater. And what we usually see on their scans is they have low activity in the prefrontal cortex, so they can't inhibit their behavior. So they don't really think about food all the time, but as soon as they smell it, they go get it. So they have poor impulse control, often associated with low prefrontal cortex activity, also associated with ADD. Maybe they had a head injury that affected that part of their brain. Please don't put them on a serotonin drug or a serotonin intervention, because you'll lower their prefrontal cortex more and ultimately make them more impulsive. That's why the research that came out in the early 90s about Prozac makes you kill your mother. Well, in fact, it can disinhibit people because of what it's doing in the brain. So the impulsive people, we want to raise dopamine. Now, you can do that. You can do it with phentermine, which is an appetite suppressant. You can do it with Ritalin or Adderall or any of the cousins to the stimulants, or you can do it with green tea, with L-tyrosine. We've actually seen rhodiola do something very similar in the brain. The other exciting thing that we found is there's certain foods that raise serotonin. So simple carbohydrates, so that's why people get addicted to sugar and wheat and pasta, or what I call smart carbohydrates. So if you think of a sweet potato or brown rice, they will actually raise serotonin. Oatmeal, but not in the same sort of powerful way that'll get somebody hooked on it. A high protein, low carbohydrate diet is very good for our impulsive people because it helps them focus. But it's a disaster for our compulsive people because they start to focus on the things that upset them. You know, I think maybe partly because of your work or because of some of the work I do with my integrative medicine colleagues, I've really been thinking a lot about gut health. And your gut is really the second brain. They're totally interconnected. And when your gut is healthy, the gut, at least the last thing I read, produces about 95% of the serotonin in your body. Okay. And if you have a leaky gut or an overgrowth of poor gut bacteria, you are not producing the serotonin and the other neurotransmitters that you need to stay healthy. You know, in the last 7 or 8 years, my last couple of books have been about the connection between physical health and emotional health, and really how people can use food as medicine. That if you look at the spices that have specific brain optimization qualities, for example, saffron and your mood, or cinnamon. It's a natural aphrodisiac that also helps to balance blood sugar and helps people focus, or oregano and rosemary that have been shown to boost blood flow to the brain. That really what you eat is either helping your brain function better or it's hurting it. So on our site, on our community site, we actually have a sophisticated neuropsychological assessment tool. So it's about a 35-minute test that'll test your memory, reaction time, focus, level of stress, mood, and then based on how you score, we give you individualized, personalized games to strengthen your weak areas. And it's one of the tools that our NFL players used, and we're very excited because as we saw their scores go up, the blood flow to their brain improved. Now, in my plans, I never do one thing. I always do the brain envy, avoid bad, do good. But when we did the whole program with them, there was significant positive improvements in their ability. I mean, some of our players improved more than 1,000% in their memory, mostly because they scored so low.
So you have a very intriguing technology and the tools that you can use to improve brain function. And I'm wondering if someone who's interested in, after hearing this and wants to learn more of your work, what's the best route to do that, either books, visits to your clinics, or websites?
Well, you know, the person who's really best for our clinic is someone who, you know, they've gone and they failed and they're really struggling to find the right help. We're really good with complicated cases, or they really don't want to use medication. They want to know, well, what are the natural alternatives? We do both. I think picking up one of my books, Change Your Brain, Change Your Life, is my best-selling book, or Change Your Brain, Change Your Body if you're concerned about your physical health. If you're concerned about aging, use your brain to change your age. I have a new book coming out next February called Unleash the Power of the Female Brain. Given that I have 3 daughters, 5 sisters, 14 nieces, I know a lot about this, maybe more than I want to know. And or people can certainly visit our website at amenclinics.com.